Hello, my name is Nick Beatty. I'm the broker for Assured Partners that helps prime prospects with their health insurance and ancillary options. I want to thank you for joining me. This is for the 2021 open enrollment for prime prospects. I will be reviewing any changes for the medical, dental, vision, accident, life insurance, and other options available through prime prospects. And I will show you what needs to be done to make your elections for the 2021 plan year. Let's get started. First, this is the medical enrollment. This is the medical and ancillary online enrollment. Starts December 9th. We will be using the Ease Central website. Medical plans are staying with Humana, and all the ancillary options will be staying with Principal. Things to keep in mind during the enrollment time. This is the time to log in and make changes to your plans. There will be new medical plans available. There'll be no changes for the Principal options, but you can make changes to your elections. And if you do not make changes now to any of these, then you must wait till December 2021, unless you have a qualifying event through the plan year, like having a baby, getting divorced, losing coverage through your spouse, losing Medicaid, losing your VA benefits. Those are just a few qualifying events that would allow you to make changes during the plan year. Outside of that, you would have to wait until next year to make those changes. Humana plans, the medical plans for 2021, there will be 3 to choose from. There'll be the Humana Core HSA plan, the Humana Buy-Up HSA plan, and the Humana Copay plan or PPO plan. I will review all 3 and give you some highlights of each one and how they work. All the plan descriptions will be available on the Ease Central system as you go through it for enrollment. There will be plan guides that you can download and read, and summary benefits descriptions right on those pages as you look them up and make your choices. First, I'll cover the Humana Core HSA plan. Now, the Humana Core HSA plan, this is a snapshot of the summary benefits of coverage, or what you will see when you go through the actual enrollment. But I want to bring up to you now on a separate page is this SBC. This is the summary of benefits of coverage. This summary of benefits of coverage is what you will see as you log in. It'll help you review this plan and ask the right questions. On the left-hand side of these SBCs are the questions you may ask. In the middle are the answers to those questions. High deductible health plans, HSA compatible plans, do not have copayments. So if you go to a provider, if you go to a specialist, primary care, urgent care, emergency room, all of those are subject to this deductible of $5,000 individual or $10,000 family. Everything is paid for by you at 100% until you meet this deductible. Once you meet the deductible under this core plan, this plan then goes into a 50-50 coinsurance. So you'll see on the following pages, 50% coinsurance up to the maximum out of pocket. The maximum out of pocket is shown on the first page. This maximum out of pocket is the 4th one down. It's $6,550 for a single, $13,100 for a family. So between your deductible and your maximum out of pocket, this plan pays 50%. You pay 50% until the maximum out of pocket is reached. Once the maximum out of pocket is reached, then this plan pays 100% of all covered services. So anything that you have medical-wise would be 100% paid for by Humana after the maximum out of pocket. This plan will be the lowest cost plan for you as an employee as you go through the website and make options and decisions. You can also set up a health savings account with Park National to put money aside to help pay for these services that are subject to your deductible. I'll discuss that in a few minutes, but I wanted to bring that up now. You can also enroll in an accident plan that'll help cover this deductible if you so choose with Principal. That's available to you during this open enrollment. So be a smart consumer. If you can save money by enrolling in this option out of your paycheck and buy the accident plan cheaper than you can to enroll for the copay plan, maybe that's a better option. You can enroll in this core HSA, save money off of your paycheck, and put aside in a health savings account for when things do happen and you need the money. Maybe that's a better option for you. The idea of offering 3 plans this year is to give you great options that you can choose from and make smart decisions. This is going to be the lowest cost one, so that's why we're covering it first. Now, back to the PowerPoint. This is the core HSA. Now we also have the buy-up HSA option, which I'll bring up now. The buy-up HSA option, this is the summary of benefits of coverage. This is also available on the East Central system. This buy-up HSA option has the same deductible as the core, a $5,000 single, $10,000 family deductible. The difference in these plans is that this plan, once you meet your deductible, that's also your maximum out of pocket. So you are at 100% coinsurance, meaning if you have $5,000 in expenses as an individual covered under this plan, any dollar after $5,000 is 100% paid for by Humana. If you're enrolled in this plan as a family, any dollar after the $10,000 deductible is 100% paid for by Humana. No co-payments here, so everything under the deductible is paid for by you as an employee, so it's a very easy benefit to understand. If you've not met your deductible, it's your expense. If you met your deductible, it's all covered by Humana at 100%. Your prescription drugs, your doctor visits, your emergency room visits. And as you scroll through these SBCs, you will see it reviews all those things, and you can read them as you see fit. This is a great option, again, to pair with maybe the accident plan, depending on your budget, to get money in case something were to happen accidentally from the accident plan to help cover your deductible under this plan. This plan is also something you can pair with an HSA at Park National Bank and contribute to in order to save money on the side to help with your deductible. So there's a couple of different ways that you can have money to help pay for those services that are subject to your deductible. Great option. I'll talk more about the HSA with Park National in 1 second. Now, the third option that you have available is the copay plan. It's also with Humana, and we say copay plan because it's just that. Before your deductible is satisfied, you will have copayments for a plethora of things. So again, this is the SBC. I'm going to pull that up now. And share it on my screen. Here is the HSA, or sorry, here is the copay plan. The copay plan reads, the SBC reads just like the HSA SBC. There's a deductible. It's a $2,000 individual, $4,000 family deductible on this plan. There is a maximum out of pocket. The maximum out of pocket on this plan is right here on the front page. It's $6,350 for a single, $12,700 for a family. Now, for this plan, if you've not met your deductible, there's co-payments. As we scroll through this, you will see right here, primary care visit is a $40 office visit copay. A specialist visit is a $100 office visit copay. Imaging, CAT scans, PET scans, MRIs is a $600 copay. All your medications are also a copay. Your medications fall in one of the 4 levels, either level 1, level 2, level 3, or level 4, depending on the cost of the prescription. If it's a generic, low-cost level 1, you would pay $10 copayment for a 30-day supply. If it's a level 2, a higher-cost generic, you would pay $45 copayment for a 30-day supply. If it's a level 3, high-cost drug, you would pay $75 copayment for a $30-day supply. Level 4 is the highest cost drug. That would cost 25% coinsurance to you, both on retail and mail order. Now, if you choose to do the mail order for level 1, 2, and 3 above, you get a 90-day supply for a 2.5 times copay amount. So you'll see on level 1, a 90-day supply mail order is a $25 copayment. A level 2 mail order is $112 for 90-day supplies. Level 3 is $187 for a 90-day supply. If you want to sign up for the mail order prescription drug list, you can do that through the Humana website. If you register for myhumana.com, you get set up for the mail order prescriptions. You also have co-payments for the emergency room here in the middle of this page. It's a $600 co-payment for an emergency room visit. It's a $100 co-payment for an urgent care visit. So this is a great plan with a low deductible, gives you options for co-payments for those things that may happen that are unknown to you. You may want to look at this plan and say that this is affordable for you and your family. You want to enroll. That's why we give you 3 options. This plan, however, is not available to set up a health savings account with Park National Bank. That's only the first 2 options. You can buy an accident plan to supplement with this plan, but you just cannot set up an HSA. Again, all these plans are available for you to change to. If you want to change your elections this year, say you were on an HSA last year, now you want to go to a PPO this year, or vice versa, all that can be done during this open enrollment. Now we'll go back to the main presentation. I want to review the HSA vendor. Give me 1 second. As I go back to our main presentation. This year, if you sign up for the core HSA or buy-up HSA, Prime Prospects has decided to partner with Park National Bank. Park National Bank will help you get signed up to enroll and open up a health savings account. A health savings account is a way for you to put money into a bank in order to help pay for those qualified medical expenses that are subject to your deductible under those HSA programs, option 1 and option 2, the core and buy-up. You can put money aside and make contributions on a per-pay basis. The reason that people set these up is, let's say if it's cheaper for you to enroll in the core HSA than it is the PPO plan, a copay plan, you can put money in, the savings or the difference, into this health savings account every paycheck and have the money there to help pay for those doctor visits that are subject to your deductible under the HSA, to help pay for those emergency room visits that are subject to deductible under the HSA, to help pay for those prescription drugs that are subject to deductible under your HSA. It's just a great way to save money to help pay for any medical expenses, qualified medical expenses, that are subject to your deductible under the HSAs. Now, if you want to get signed up, there'll be information that's passed out by HR to contact Park National Bank. They will reach out to you. They will help you set up these accounts so you can get those working to your favor. Also, if you enroll in one of these 3 medical plans, you have an option to earn money through a wellness program. Humana offers a wellness program called Go365. Go365 is an application you can download to your phone, and you can unlock activities, earn rewards, stay inspired, and get a higher status for your points. This works on a metallic system. It goes from bronze to silver to gold to platinum. If you download this Go365 app to your phone, you'll be able to earn rewards by tracking your steps, logging workouts, doing things to maintain your health. And these dollars that you earn rewards for are real dollars that you can turn into gift cards for your family. The first step that you would take after you go to go365.com or download the Go365 app is take the online health assessment. It will take you about 10 minutes to complete. Also, we encourage you with all the plans, there is a preventative service. All preventative services are covered at 100%, free to you. You complete your biometric screening with your physician each year during your physical. You load that up to the Go365, the results that is to the Go365. That'll get you pretty much to a silver status. Then if you complete a verified workout, you're right there at a silver status for this Go365, which will earn you dollars. So please, we encourage you, if you enroll in any of these options, to do wellness this year. It only helps us as a team to be able to save money on your health insurance at these renewals, and it gives you a great way to earn bucks and dollars that you can put back into your pocket. Now we're going to switch gears and go to the ancillary open enrollment information. So all these lines are with Principal, and these lines that are offered for 2021 are voluntary supplemental life and accidental death and dismemberment, voluntary short-term disability, voluntary accident, voluntary dental and vision. Now I'll review these benefits. The voluntary life insurance for employee and dependents. Prime Prospects provides employees working at least 25 hours a week the opportunity to extend coverage for yourself and for your dependents and provide financial safety and help protect the well-being of your family. If you're not currently enrolled in this, you may purchase up to $20,000 for yourself, $10,000 for your spouse, and $10,000 for your children without answering medical questions. If you already have this benefit and you're enrolled, you may increase your elections this year at open enrollment by the above amounts without completing medical questions. If you waive this benefit at your new hire this year and now you want to get on, you can only do the buy-ups. All other requests will require a statement of health and underwriting approval outside of these. Here's the benefits below. You can buy increments of $10,000 up to $3,000 as an employee, guaranteed issues of $100,000. The spouse can buy 100% of the employee amount up to $100,000. In increments of $5,000, guaranteed issue for a spouse is $30,000. And children get a $10,000 benefit amount. Regardless of how many children you have, it's the same price. They must be 14 days old, and they can keep this policy to the age of 26. Some benefits that I want to review with this policy for the voluntary life is portable and convertible. So if you do leave Prime Prospects, you can convert this and take it with you. It does have an accelerated death benefit. There is a waiver of premium if you are disabled. The spouse rate is based on your age as an employee. The accidental death and dismemberment amount is the same as the life insurance amount that you elect. There are age-rated adjustments 1 time a year. So if you're enrolled in this plan last year and you're going to continue this next year with the same amount, you may see a slight increase on your paycheck deduction only because now you're older. This is an age-banded product, meaning as you get older, it does increase in premium. This benefit does reduce. When you're 65, it reduces by 35%. And when you're 70, it reduces by 50%. The certificate is available on East Central for all the rest of the exclusions and limitations. Make sure you pay attention to those. But these are the highlights of the voluntary life policy. Now we're going to move into the voluntary short term. This plan deduction could increase as well if you received a raise in your earnings in 2020, because this benefit is based off of your income. So this is how it works. This pays you 60% of your weekly earnings. So if you receive more now than what you did last year, obviously it would be a little more expensive to cover that increase in pay. The maximum benefit you could get per week from this policy would be $500. This benefit starts paying you 60% of your earnings on a weekly basis after the 8th day of an accident or illness. This benefit lasts for 12 weeks in a row. So this is really good for, obviously, women who are in childbearing years, because it would pay you while you're out on maternity. It also helps for people that may have those intermittent illnesses or accidents that need to receive a paycheck. This is available for any employee working 25 plus hours a week for prime prospects. Voluntary accident. I talked about this earlier when we were reviewing medical. This plan can be selected with any of the medical plans and can help you pay for out-of-pocket expenses for things that happen to you via an accident. If you have this coupled with any of the medical plans, it pays you directly these cash benefits, which then you can in turn use however you see fit to help pay for your medical expenses, to help offset something else. But these are how it's paid. I highlighted just a few of the payouts here. All the additional payouts are available on the East Central system, but these are some of the big ones. Covered charges are burns, comas, concussions, dental injuries, dislocations, fractures, knee injuries, ruptured discs, tendon, ligaments, or rotator cuff surgery. You will see on this page where it says up to amounts. Those depend on how severe those injuries are. So how severe a burn is, or how severe a dislocation is, or a fracture. If they require surgery, the payouts are larger. That's why you see up to amounts. The other amounts that you see here, that's a set amount. Those are set amounts. It's not up to. So if something like that happens to you, those would be the amounts that you would receive. This is a great plan. And again, you can enroll in this if you did not choose it last year. No questions asked. It is available for you to take. Now I want to jump into the dental. Dental benefits paid out are like this. There's 3 different categories. This is the same plan that you had last year. There's no change in the pricing from last year. The 3 categories that your services are paid out in is preventative, basic, and major. If your services fall under the preventative category, it's 100% paid for by principal, no deductible. If your services fall under the basic category, you pay your deductible, which is a $50 if you're enrolled as an individual, or $150 if you're enrolled as a family. And then principal pays 80%, you pay 20%. This plan has a $1,000 maximum benefit for you each year. And if you have yourself and a spouse enrolled, it's $1,000 per each family member enrolled. The major category, if a service falls there, after the deductible, this plan pays 50%, you pay 50%. Your deductible is only paid one time a year. So if you have a service that falls in basic, and then later on in the year you have a service that falls in major, you do not pay that deductible twice. You would only pay it the first time you receive the basic service. Additional benefits under the dental plan is there is an overall benefit max for orthodontia for children under the age of 19. It's a $1,000 lifetime max for each child. You also have a maximum benefit rollover. So that means if you're enrolled in this benefit or dental plan last year and you did not spend 50% of the total $1,000 you had to spend, you would receive an increase in that benefit max this year. So you'd receive an additional $250 to spend for 2021. So instead of $1,000, you now have $1,250 to spend for 2021. It's a great benefit in a way for us to kind of incentivize you to go ahead and take it and enroll in it. And if you don't use it, you don't lose it. It just builds up. If you need to know if you do have an increased amount, you can call a principal using your plan ID number on your card and ask them what your new benefit amount is. Now, Vision. Again, Vision's also offered by Principal. Before I go over the Vision, I just want to point out all these plans with Principal can be enrolled in however you see fit. You can enroll yourself into life. You can enroll your family for the dental. You can enroll you and just your spouse for the Vision. The enrollments do not have to match. You can mix and match everything. Obviously, the short-term disability is an employee-only benefit, but all the other plans, the accident, vision, the dental, and the life insurance, you can mix and match your enrollment types. Now, for the Vision benefits, again, no change in pricing for 2021 from the plan that was in place in 2020. How Vision benefits work are like this. They work on a frequency basis and they work on a co-payment basis. So depending if you get an exam, a frame of contacts, or lenses, you have frequencies on how often you can get those. And these are time-stamped. These do not reset January 1. So exams, you get one of those every 12 months. If you received an exam on July 12th of 2020, you would be able to receive another exam on July 12th of 2021. That's what I mean by timestamp. That's when it would reset. Frames and contacts, you can get one set of those every 24 months. Lenses, one set every 12 months. Here's the co-payments. For exams, you pay $10 for your exam every 12 months. Prescription lenses is a $25 co-payment for single, vision, line, bifocals, trifocals, lenticulars. Frames, Principal gives you $130 to spend. So if you spend less than $130 on your frames, it's absolutely free. If you spend more than $130, they're going to give you $130 and then a percentage off the overage. Contacts, you could have up to a $60 copay. Now, this plan does not cover both contacts and frames. You choose one or the other in that 24 months period. My suggestion is you take this policy and purchase the most expensive one, and then go online and purchase the other, either at 1-800-CONTACTS or glasses.com, depending on the price they have there. Use this plan to pay for the more expensive one. You also get additional savings with this plan, like laser vision correction and additional pairs of glasses and non-prescription sunglasses, and also lens enhancements at a 20 to 25% discount. This is a great plan. Vision is easily purchased, is very inexpensive, and if you have glasses or need contacts, I highly suggest you look into this benefit and enroll. Now I want to go over how you're going to be choosing these plans. We're going to be using the same system we used last year, which is eCentral. All elections will be captured online through this benefit administration system, eCentral. Please use the login information you already set up as a new hire. You can reset your password on the login screen if you forgot it. And if you cannot reset your password because you lost your username, please reach out to HR. Once you get to the website, this is what it looks like. Please, again, use your username and log in. You can log in with your mobile phone, or you're unable to log in. Please click those buttons to reset your password. Once you get into the system, you will be taken to your dashboard. This is where you're going to start your enrollment. Once you get in there, you'll have to walk through all of your benefits. You will see on the right-hand side of the page, you will be given a checklist of benefit summary. This shows you the total cost per pay of items you've enrolled in and keeps a running tab so you can see at the end what you've signed up for and how much it's going to cost you per pay. I want to set out a big reminder that if you do take the life insurance this year, or you are continuing to stay enrolled in a life insurance, that you complete the beneficiary on this eCentral system. Please make sure it's updated. A lot of things happen throughout the plan year that maybe you want to change your beneficiary. This is a good time to remind yourself to get that done. So please go in here and make sure you have the correct beneficiary on file for your life insurance. You're not done with the system until you get to this review and sign forms electronically. You then electronically sign and press continue. That will end your session of enrollment, which will take you to this page, which is your enrollment summary. On the enrollment summary, you will see everything that you're enrolled in, how much it costs on the right-hand side, and when it will take effect, and who's enrolled in those programs. At the very end, you will say, congratulations, you've been submitted for review. At the top right, you can click finish. At that time, you are completely done with the enrollment. We thank you for your time. If you have questions, please reach out to HR. I hope that everyone has a great holiday season. We appreciate your business, and we hope that you have a happy and healthy 2021.